Medical Action Myanmar is a young charity. It's only been operating in one of the world's poorest places for 5 years, yet already reaches more than 300,000 patients a year, often in the most remote places of the country. The needs in Burma are huge. Medical Action Myanmar's network of doctors and health workers provide a mix of activities including mother and child care, treatment of malnourished children, reproductive health, malaria, family planning, treatment of sexually transmitted infections, counselling, and treatment for people with HIV, AIDS, and tuberculosis. Here, at this Mam Medical Centre in the heart of one of Yangon's biggest settlements, more than 350 people are seen a day. This young girl has been a patient since before she was born. Her mother is HIV positive, but was given antiretroviral treatment throughout her pregnancy to prevent transmission of HIV to her unborn child. MAM supports more than 2,000 people with this treatment. In a country which has little medical infrastructure, this clinic is one of 7 that MAM runs which provide a wide range of services. In Myanmar, children under 5 are the most vulnerable from infectious diseases like measles and pneumonia, and they have the highest mortality rates. But MAM is countering this, and has introduced therapeutic feeding and medical treatment to all children who are vulnerable. MAM was set up by Dr. Frank Smithowis and Dr. Nini Tun, who between them have more than 30 years of experience in Myanmar. MAM offers a comprehensive program of care, making sure none of its patients leave hungry and unprotected.
We started 3 clinics in Yangon, and we have, which is HIV, TB, integrated clinic. So we treat basically all the primary health care, and also HIV, TB, and STI, and pregnant mother, and malnutrition feeding center.
You see sick children, adults, men, women, they would die of this disease if they do not have access. They do not have access, they don't have the financial means. And with us trying to get money from donors, we can treat them and they survive. So that's a very simple, but very relevant activity. And it became almost addictive. So in general, I think it's moving absolutely in the right direction. For my organization, I have to say that we need more money. With more money, we can reach more people.
MAM has built a network of more than 900 community health workers who work in the most remote villages in North and East Myanmar. For many thousands, it's the first time they have received such care. They now receive treatment for malaria and TB, and tens of thousands more have been tested and treated for other common diseases. HIV/AIDS is a major killer in Myanmar, and MAM is seeing more and more infections in women and children. The level of ignorance about HIV is still high, and access to antiretroviral treatment, ART, is very low. To most, ART is unaffordable. In developed countries, the incidence of CMV has dropped dramatically, thanks to ART. But in Myanmar, it is a neglected disease, and Medical Action Myanmar is leading the drive to slow its progress. No patient will ever be turned away from a MAM clinic for financial reasons. Medical Action Myanmar is committed to providing treatment and support for all, so this mother and her daughter, and countless others like them, will be safe in the future.
She was very young last year, you remember?
Yes.
Yes. Now she is 1 year and 2 months old, and they did the first HIV testing when she was 9 months. It was negative.
Negative. Very good.
And the baby is healthy.
She looks great.
所以ပြော一講。